Your body has a way of warning you when something is very wrong. And sometimes that warning comes from a place you would never expect, from smell. I am not talking about the smell of sweat after a hot day. I am talking about a different smell, strange, that appears for no apparent reason, and that can be the first sign of a serious infection in your joints. An infection that, if not treated in time, can destroy your knee, your hip, or your shoulder in a matter of days. My name is Finley Crosden. I am a rheumatologist with over 20 years of experience, and today I am going to teach you how to recognize this signal that your body sends before even the classic symptoms appear. Let me tell you something that completely changed the way I guide my patients. For years, medicine taught that the signs of joint infection are intense pain, swelling, redness, and fever. And they are. But those are the signs when the infection is already established, when bacteria are already destroying the cartilage from the inside. What few doctors mention is that there is a sign that can appear before all of that. A sign that your own body produces as an initial response to bacterial invasion. And that sign is odor. You probably never heard about this, right? When you think of infection, you think of fever, pain, pus. Nobody teaches you to pay attention to smell. But the truth is that our body is an incredible communication machine. It is constantly sending signals about what is happening inside. And one of those signals is the odor we produce. Doctors in ancient Greece already used smell to diagnose diseases. They knew that diabetes caused sweet breath, that liver problems caused a characteristic odor. Modern science confirmed they were right, and now we know that joint infections also have their own smell. Let me explain the science behind this. When bacteria invade a joint, they start multiplying in the synovial fluid, that liquid that lubricates and protects your joints. Some of these bacteria, especially anaerobic ones, which are those that live without oxygen, produce volatile chemical compounds as a byproduct of their metabolism. These compounds have an odor, and that odor can manifest in several ways: through the skin around the joint, through sweat, or even as a general change in the person's body odor. Rheumatology and orthopedic manuals are clear. Foul smell of synovial fluid suggests anaerobic infection. This is in the textbooks. It is in the protocols. But almost nobody teaches patients to pay attention to this. The most common bacteria in joint infections is Staphylococcus aureus, which causes more than half of the cases. But there are others, like Streptococcus, gram-negative bacilli, and anaerobic bacteria like Bacteroides. Each type of bacteria produces different compounds, but many of them have a characteristic odor. When an experienced orthopedist or rheumatologist performs a joint puncture and smells a fetid odor in the fluid that comes out, they already know they are very likely dealing with a serious infection. It is a clinical sign recognized by medicine. The difference is that this smell can sometimes be perceived even before the puncture, through the skin, especially in more superficial joints like the knee. Let me tell you about Gerald. He is 72 years old, retired, worked his whole life as a bus driver here in the Chicago area. Strong man, active, never had serious health problems. Controlled diabetic, takes his metformin correctly, walks 3 times a week in the park near his house. One day, he came to see me with a complaint that seemed simple. His right knee was a bit swollen and sore. Nothing too serious, according to him. It had started about 4 days earlier. He thought it was strain, that he had pushed too hard on his walk. He took an anti-inflammatory he had at home and waited for it to get better. But it did not improve, so he decided to come to the office, more at his wife's insistence than his own initiative. But then he told me something that set off a red alert in my head. Doctor, there is something strange. My wife says I have a different smell. She says that when I take off my pants at night, a weird smell comes from my leg. It is not a sweat smell, it is different. Kind of sour, kind of rotten. I thought it was her imagination, but she insisted so much that I decided to mention it. At that moment, I already knew what was probably happening. I asked him to lie down on the examination table and examined the knee. It was slightly swollen, a bit warm to the touch, but nothing that looked like an emergency at first glance. Many doctors would have prescribed an anti-inflammatory and sent him home. But that information about the smell made me take a different decision. I am going to do a puncture on your knee now, Gerald. I need to see the fluid that is in there. He looked at me scared. Puncture? But doctor, it does not hurt that much. Is it really necessary? I explained that yes, that smell his wife had noticed could be an important sign. I performed the arthrocentesis, which is the technical name for the procedure. When the fluid came out, I felt it immediately. A fetid, characteristic odor. The fluid was cloudy, yellowish, with that unmistakable smell of bacterial infection. I sent the material to the laboratory urgently. Meanwhile, I already started intravenous antibiotics. I could not wait for the culture results. Septic arthritis, which is the name of this joint infection, is a medical emergency. Every hour that passes without treatment, more cartilage is destroyed. The result came the next day. Staphylococcus aureus, the most common bacteria in this type of infection. Gerald stayed hospitalized for 10 days, receiving antibiotics through IV and having his knee drained. But he recovered completely. We saved his joint. And you know what he told me when he was discharged? Doctor, if it were not for my wife talking about that smell, I would have let it go. I would have taken an anti-inflammatory and waited for it to get better on its own. She saved my knee. This information you are receiving now can save your joint or someone you love. That is why I need you to hit the like button and subscribe to this channel. When you do that, you help this video reach more people who need to know this. Septic arthritis affects about 5 people per 100,000 per year. It seems like few, but when it happens to you or someone in your family, it is devastating. And most people do not know these early warning signs. So go ahead, like and subscribe now. Now let me explain why the smell appears before the other symptoms. When bacteria enter the joint, they find a perfect environment to multiply. Warm, moist, full of nutrients. Normal synovial fluid is sterile. It has no bacteria. But when they get there, whether through the bloodstream from an infection elsewhere in the body, or through a wound or nearby injury, they start reproducing rapidly. In this process of multiplication and metabolism, bacteria produce chemical substances. Some of these substances are volatile compounds that have a characteristic odor. Scientists call these volatile organic compounds, or VOCs. These compounds can diffuse through the tissues around the joint and reach the skin. Intense pain, visible swelling, redness, and high fever usually appear when the infection is already more advanced, when the immune system has already mounted a strong inflammatory response. But the smell can appear before that, in the early stages, when the bacteria are still establishing themselves. It is like an early alarm that your body triggers. The problem is that most people ignore this alarm. They think it is sweat. They think it is lack of hygiene. They think it is imagination. And when the classic symptoms appear, the infection is already destroying the cartilage. But attention, not every change in body odor means joint infection. The human body produces different smells for various reasons. Uncontrolled diabetes can cause a sweet or fruity odor in breath and sweat because of ketones that accumulate in the blood. Kidney problems can cause an ammonia smell because the kidneys cannot filter toxins properly. Liver problems can cause a musty or garlic smell due to metabolic changes. Urinary infections cause strong odor in urine. Even some medications can alter the smell of sweat and body. What I want you to pay attention to is the specific combination. Change in odor plus some joint discomfort, even if mild. Swelling, local heat, difficulty moving the joint, pain that does not improve with rest. That combination is the red alert signal. I want to hear from you now. Have you noticed any strange change in your body odor? Or has someone close to you commented on something? Comment below. I want to understand the reality of those who watch me. Let me tell you about the risk factors for septic arthritis. Some people are more likely to develop this infection than others. If you fit into any of these groups, you need to be even more attentive to the signs. First, people with diabetes. Diabetes impairs the immune system and makes it harder to fight infections. Gerald was diabetic, and that probably contributed to his case. Second, people with rheumatoid arthritis or other autoimmune diseases. These conditions already leave the joints more vulnerable, and the immunosuppressive medications used in treatment reduce the body's defenses. Third, people who had recent joint surgery or have a knee or hip replacement. The prosthesis is a foreign body where bacteria can lodge. Fourth, people with wounds or skin infections. Skin bacteria can enter the bloodstream and settle in the joints. Fifth, people over 60. The immune system weakens with age. If you are in any of these risk groups, any new joint discomfort deserves attention. And if it comes accompanied by a change in body odor, seek medical help immediately. Do not wait for the pain to become unbearable. Do not wait for fever to appear. Early diagnosis makes all the difference in treatment outcome. Now I am going to teach you what to do if you suspect a joint infection. First, do not take anti-inflammatory on your own and wait for it to improve. The anti-inflammatory can mask symptoms and give a false sense of improvement, while the infection continues destroying your joint from the inside. Second, seek an emergency room or a rheumatologist as quickly as possible. Talk about all symptoms, including any change in odor that you or someone close has noticed. Third, be prepared to have tests done. The definitive diagnosis of septic arthritis is made through joint puncture and analysis of the synovial fluid. It is a simple procedure, done with local anesthesia, that takes just a few minutes. The fluid is sent to the laboratory to identify which bacteria is causing the infection. While the result is not ready, the doctor already starts antibiotics because you cannot wait. By the way, for those who want to learn more about joint health and warning signs that the body sends, I left the definitive guide to strengthening muscles and joints after 60 in the pinned comment and in the description. There is more information about how to protect your joints and when to seek medical help. If you are interested, check it out later. The treatment for septic arthritis is aggressive but necessary. It usually involves intravenous antibiotics for 1 to 2 weeks in the hospital, followed by oral antibiotics for a few more weeks at home. In addition to antibiotics, the infected joint needs to be drained, either by needle multiple times, by arthroscopy, or by open surgery in more severe cases. The goal is to remove all the pus and bacteria from inside the joint. If treatment is started within the first 24 to 48 hours, the chances of complete recovery exceed 90%. But if it takes more than a week, the damage can be permanent. Destroyed cartilage does not regenerate. The person may be left with chronic pain, limited movement, or need a joint replacement in the future. Let me tell you another case that illustrates well the importance of early diagnosis. Margaret, 68 years old, came to see me after having seen 2 doctors. She had hip pain for 3 weeks. The first doctor said it was age-related arthritis and prescribed anti-inflammatory. The second doctor ordered an X-ray, saw nothing special, and kept the anti-inflammatory. When she arrived at my office, she could barely walk. The pain was unbearable, and she told me something that none of the other doctors had asked about. About 2 weeks ago, her husband had mentioned that she had a different smell. She ignored it because she was taking a new medication and thought it could be a side effect. I ordered an MRI of her hip urgently. Signs of joint destruction could already be seen. I admitted her the same day. We did ultrasound-guided puncture because the hip is a harder joint to access, and we confirmed the infection. She needed surgery to drain the hip and stayed almost 3 weeks hospitalized. Unfortunately, because of the delay in diagnosis, she was left with lasting effects. Today, she walks with difficulty and will probably need a replacement in the future. If that first doctor had investigated better, if someone had paid attention to the smell her husband noticed, the outcome could have been different. That is why I insist so much on this point. You need to know your body. Pay attention to the signals it sends, and talk about these signals with your doctor, even if they seem silly. A strange smell may seem irrelevant, but combined with other symptoms, it can be the missing piece for the correct diagnosis. Let me give you some practical guidance to protect your joints from infections. First, take good care of any wound on your skin. Wash it with soap and water. Keep it clean and covered. If a wound becomes red, swollen, or has pus, seek medical attention. Skin bacteria are the main source of septic arthritis. Second, keep your diabetes controlled if you are diabetic. High blood sugar impairs your defenses against infections. Third, if you have a joint replacement, always tell your dentist and any doctor before procedures. Sometimes preventive antibiotics are needed before dental treatments to prevent bacteria from entering the bloodstream and settling in the prosthesis. Fourth, if you use immunosuppressive medications, be even more attentive to any sign of infection. Your body has less ability to fight invaders, so you need to compensate with vigilance. I will summarize the main points of this video. First, bad body odor or a strange smell coming from a joint area can be an early sign of joint infection, appearing before intense pain, visible swelling, and fever. Second, this smell is produced by bacteria multiplying inside the joint, especially anaerobic bacteria that produce volatile chemical compounds with characteristic odor. Third, people with diabetes, rheumatoid arthritis, joint replacements, skin wounds, or advanced age have higher risk of developing septic arthritis. Fourth, if you notice joint discomfort accompanied by change in body odor, seek medical attention immediately. Do not wait for symptoms to worsen. Fifth, early diagnosis and rapid treatment are essential to save the joint. Delay can result in permanent damage to cartilage. I have been treating people with joint problems for over 20 years. I have seen cases diagnosed in time with complete recovery, and I have seen cases that took too long and left lifelong consequences. The difference between one outcome and another often lies in the small details that people notice but do not give importance to. A different smell. A pain that does not seem so bad. A swelling that could be anything. These small signs, when interpreted correctly, can change the course of a disease. You have 2 choices now. First, you ignore this information. Keep thinking that body odor is just a matter of hygiene, and if one day you have joint discomfort, you take an anti-inflammatory and wait for it to pass. Second choice. You take this information seriously. You start paying attention to the signals your body sends. And if you notice something strange, you seek medical help without delay. Gerald made the second choice, even without knowing it. His wife paid attention. He mentioned it to the doctor, and that saved his knee. Margaret was not so lucky. Nobody gave importance to the sign her husband noticed, and she lives with the consequences today. The choice is yours. Take care of your joints. They allow you to walk, hug, live with independence. Text this video to that friend or family member who has diabetes, to that person who has rheumatoid arthritis, to whoever has a knee or hip replacement, to anyone over 60 that you know. You can save someone's joint by sharing this information now. Thanks for watching. Take care of your body. See you in the next video. Stay strong and stay healthy.